I want to be upfront with you about something before I get started today. I've been a practicing physician for over 20 years, and in all that time, one of the most common things I hear from men over 60 is this: Dr. Weston, I don't know what happened to me. And I get it, I really do. Because what's happening to your body right now isn't something anybody warned you about. Nobody sat you down at 55 and said, hey, in a few years your circulation is going to start working against you, and here's what you need to do about it. Nobody told you that. And that silence, that's exactly what I want to fix today. So here's my promise to you right now before we go any further. By the time this video is done, you're going to have a specific formula, a real dosage, a clear protocol, not vague advice, not just eat healthy, but an actual step-by-step method using two things you can pick up at any grocery store in America for under $10. I'm going to give you the exact ratio, the exact timing, and exactly what to expect. No fluff, no runaround. That's my commitment to you today. Now let me tell you what's actually going on inside your body, because understanding this changes everything. When you were younger, let's say in your 30s and 40s, your arteries were flexible. They expanded and contracted easily. Blood moved through them freely, reaching every part of your body the way it was supposed to. And one of the key reasons that works so well is a molecule called nitric oxide. Nitric oxide is produced in the lining of your blood vessels, what we call the endothelium, and its job is to signal your arteries to relax and open up. When nitric oxide is flowing, blood flows. It's that direct. But here's what happens as men age. Starting around 50 and accelerating significantly after 60, your body produces less and less nitric oxide. The endothelium and that delicate inner lining of your arteries starts to stiffen. Plaque builds up. Inflammation sets in. And the vessels that used to open wide and let blood rush through start narrowing. They get rigid. They stop responding the way they used to. And the first place that shows up, the first place you notice it, isn't your heart, it isn't your brain, it's your sexual function. Because the tissue involved in male arousal requires more precise, more concentrated blood flow than almost anywhere else in the body. When circulation starts declining, that's the earliest warning signal your body sends you. And most men either miss it or they're too embarrassed to talk about it. I've sat across from hundreds of men in my clinic. Guys who played college football, guys who worked construction their whole lives, guys who never got sick a day until they hit 62 or 63. And they all describe the same thing. It starts as inconsistency. Then it becomes avoidance. Then avoidance turns into distance. And distance turns into something that affects not just their health, but their marriage, their confidence, their entire sense of self. And I want to be real with you, that's not weakness. That is biology. That is what happens when nitric oxide drops, when arterial flexibility decreases, when the communication between your brain and your blood vessels starts breaking down. This isn't a character flaw. This is a circulation problem, and circulation problems can be addressed. Now, when most men come to me with this issue, the conventional medical response is pills. And look, I'm not here to bash pharmaceuticals. They have their place. But what I've seen over 20 plus years is that pills don't fix the underlying problem. They're a temporary workaround. They force blood flow artificially for a few hours. And then when the drug wears off, you're right back where you started. Sometimes worse, because your body starts depending on that chemical signal instead of producing its own. What I want to talk to you about today is something different. Something that actually addresses the root cause, the endothelial dysfunction, the nitric oxide deficiency, the arterial stiffness, using two natural compounds that have been studied extensively and that I have personally recommended to patients for years. Those two things are extra virgin olive oil and apple cider vinegar. Now, before you roll your eyes, I know it sounds almost too simple, and I get why you'd be skeptical, but stay with me here, because the science behind this combination is genuinely impressive, and once you understand why it works, it's going to make a lot of sense. Let's start with extra virgin olive oil. The key active compound in extra virgin olive oil is called oleocanthal. And this is important. Oleocanthal is a natural anti-inflammatory agent that works in a way very similar to ibuprofen, except it doesn't damage your gut lining. But more relevant to what we're talking about today, extra virgin olive oil is extremely rich in polyphenols, particularly a compound called oleuropein. And what oleuropein does is stimulate the endothelium, that inner lining of your arteries, to produce more nitric oxide. Multiple clinical studies, including research published in journals that I trust and read regularly, have shown that daily consumption of extra virgin olive oil measurably increases nitric oxide bioavailability. In plain terms, it tells your arteries to open up. It makes your blood vessels more responsive. It reduces the oxidative stress that causes that arterial stiffness I was talking about earlier. But here's the thing, and this is where most people stop short. Olive oil alone has a limitation. Its fat-soluble compounds need an activation partner to be fully absorbed and utilized by your body. Without that partner, you're getting maybe 40 to 50% of the benefit. You're leaving half the value sitting on the table. That's where apple cider vinegar comes in. Apple cider vinegar, specifically the raw, unfiltered kind with what's called the mother, that cloudy sediment at the bottom of the bottle, contains acetic acid, enzymes, and beneficial probiotics. And when it comes to circulation, acetic acid does something remarkable. It lowers blood viscosity. In simpler terms, it makes your blood less thick, less sticky, easier to move through your vessels. Think of it this way. Imagine your arteries are like garden hoses. Olive oil is widening the hose, making it more flexible, more open. Apple cider vinegar is thinning the water running through it so it moves faster and more freely. Together, these two compounds create a synergistic effect on blood flow that neither one produces alone. That's the science. That's why this combination matters. Additionally, apple cider vinegar has been shown to improve insulin sensitivity, which is directly connected to endothelial health. When your cells are more insulin sensitive, there's less inflammation in your arterial walls, which means better nitric oxide production, which means better circulation. It all connects. Now, here's what you've been waiting for, the exact protocol. I'm going to be specific because I know that's what you need. Every morning on an empty stomach, you're going to mix 1 tablespoon of raw, unfiltered apple cider vinegar. Bragg's is the most widely available brand in the US. You can find it at Walmart, Kroger, Whole Foods, basically anywhere, with 1 tablespoon of extra virgin olive oil. Make sure it says extra virgin on the label, not just olive oil. That distinction matters because only extra virgin retains the full polyphenol content. Add this mixture to about 4 to 6 ounces of warm water. Not hot, not cold, warm. Stir it well and drink it down. That's it. 1 tablespoon of each in warm water every morning before you eat anything. Now, some of you are going to ask, and I've gotten this question from patients, can I take this twice a day? The answer is yes. You can take a second dose in the evening, about 30 minutes before dinner. But I want to be clear, the morning dose is the non-negotiable one. That's when your body is most primed to absorb these compounds, and that's when the effect on your nitric oxide production is most pronounced. If you can only do it once a day, do it in the morning. What should you expect in terms of timeline? I'm going to be honest with you the way I am with my patients, because I think you deserve straight talk. You're not going to feel a dramatic difference in 24 hours. Anyone telling you that is selling you something I wouldn't buy. What my patients typically report is this. In the first week, better energy and slightly improved morning vitality. By weeks 2 and 3, noticeably improved circulation, warmer hands and feet, less fatigue after physical activity. By week 4 to 6, the majority of men I've worked with report meaningful improvement in sexual function and responsiveness. By 90 days of consistent use, the changes are significant and sustained. The key word there is consistent. This isn't a one-time fix. This is a daily habit, the same way brushing your teeth is a daily habit. You don't brush your teeth once and expect them to stay clean forever. You're rebuilding your endothelial health over time, and that requires showing up every day. Now let me address something a few of you may be thinking, because I've heard this before. Dr. Weston, if this works, why aren't all doctors recommending it? That's a fair question, and it deserves a real answer. The honest answer is a combination of factors. Medical training in the United States, and I went through it, so I can speak to this personally, focuses overwhelmingly on pharmaceutical interventions. Natural compounds don't go through the same clinical trial pipeline that drugs do, partly because you can't patent an olive tree. There's less financial incentive to fund large-scale studies on food-based interventions compared to a drug that can generate billions in revenue. That doesn't mean the science isn't there. It absolutely is. But it means fewer doctors are trained to look for it, discuss it, or recommend it with confidence. I'm not saying the medical system is corrupt. I'm saying it has blind spots. And one of those blind spots is the very real, very well documented cardiovascular benefit of the Mediterranean diet compounds, of which extra virgin olive oil and apple cider vinegar are key players. I've spent the last 2 decades filling in that blind spot for my patients, and today I'm filling it in for you. Let me also talk about a few things that can either help or undermine what you're trying to do here, because context matters. Hydration is enormous. A lot of men over 60 are chronically mildly dehydrated and don't know it. When you're dehydrated, your blood thickens, the exact opposite of what the apple cider vinegar is trying to accomplish. I tell my male patients over 60, aim for at least 64 ounces of water a day, and more if you're physically active. Start your morning with a full glass of water before you even take the olive oil and vinegar mixture. Walking matters more than most people realize. I'm not talking about running marathons. I'm talking about a 20 to 30 minute walk 5 days a week. That level of physical activity has been shown in study after study to directly stimulate nitric oxide production in the endothelium. It works synergistically with what the olive oil is doing. You pair the daily mixture with a consistent walking habit, and you're going to see results faster. Sleep is non-negotiable. Testosterone, which plays a major role in male sexual function, is primarily produced during deep sleep. Men who sleep fewer than 6 hours consistently have measurably lower testosterone and worse endothelial function. If you're not prioritizing sleep, you're fighting uphill. I tell patients, the olive oil and vinegar protocol works best in a body that's getting 7 to 8 hours of quality sleep. If sleep is an issue for you, that's a whole other conversation we should have, but don't underestimate how much it matters here. Now, I want to say something that's a little outside the usual health content, but I think it's important because I've seen it matter in real patients' lives. When men experience these kinds of physical changes, the decline in sexual function, the loss of confidence, the avoidance, it often creates a wall of silence in their relationships. And that silence is almost always more damaging than the physical issue itself. I've had patients come in who hadn't spoken honestly to their wives about what they were going through for years. And the wives were often interpreting that silence as rejection, as loss of attraction, as something they'd done wrong. If that's you, if you're carrying this quietly, I want to encourage you to say something. Not everything, not all at once, but something. Because the men I've seen make the best progress aren't necessarily the ones who started with the worst symptoms. They're the ones who stopped carrying it alone. Healing physical function and healing relational function tend to go hand in hand, and I've watched that happen in my practice more times than I can count. You are not the only man going through this. You are not alone in this room, wherever you're watching from, whether that's your living room in Ohio, your kitchen table in Texas, your back porch in Florida. There are millions of men your age navigating exactly what you're navigating. And the fact that you're here, watching this, trying to understand and do something about it, that already says something about who you are. Let me bring this back around to what matters most, because I want to make sure you leave today with complete clarity. Your body's not broken. What's happening to you is a biological process. Reduced nitric oxide production, increased arterial stiffness, decreased endothelial responsiveness, and it is addressable, not with a pill that forces a temporary result, but with a consistent, natural, evidence-based approach that supports your body's own ability to restore circulation. The protocol is simple. Every morning, on an empty stomach, 1 tablespoon of extra virgin olive oil, 1 tablespoon of raw, unfiltered apple cider vinegar, mixed into 4 to 6 ounces of warm water. Optional second dose 30 minutes before dinner. Pair it with adequate hydration, daily walking, and quality sleep. Give it 30 to 90 days of honest, consistent effort. That's the whole thing. That's what the research supports. That's what I've seen work in real men, in my real practice, over the last 20 plus years. If this helped you today, do me a favor. Share it with someone who needs it. There are men in your life, I guarantee it, who are dealing with the same thing and haven't found this information yet. Send it to them. That's how we take care of each other. And if you have questions about dosage, about combinations, about what to do if you have a specific health condition, leave them in the comments below. I read them. My team reads them. We make content based on what you're actually asking, so your questions genuinely matter and they shape what we cover next. You showed up today. You did that. Now go take care of yourself because you've earned it and you deserve to feel like yourself again.